So just to make everyone aware, we are going to be taking questions throughout the session today. So if you wanted to submit a question and you haven't done so already at registration, please use the Q&A box just at the bottom menu. Again, if you're using a mobile device, you can find that in the More button in the top right-hand corner. If you have submitted a question, we will be putting those to the panel at the end. So I can see that the numbers are steady. So what we'll do is, I think we are good to go and we'll get started. For those just joining, the session will be recorded, so you'll receive a link to the recording shortly afterwards. So just to introduce myself, my name's Maisie Cascadden and I'm the events manager here at the BTA. And today I'll be joined by Nick Ray, the communications manager at the BTA, Professor Kevin Monroe, whose roles include Ewing Professor of Audiology, Director of the Manchester Centre of Audiology and Deafness, and Deputy Director of NIHR Manchester Biomedical Research Centre. We'll also be joined by Dr. Eldre Bucas, postdoc fellow in audiology at Anglo-Ruskin University, and Henri Rowe, founder of I Am Ear, based in London. So starting today's session, we will be hearing some brief introductions from our guest panel. So I will start off by handing over to Nick.
Thank you very much, Maisie. I'm just going to share a few slides. As Maisie said, I'm Nick Ray and I'm the Communications Manager for the British Tinnitus Association. I've worked for the organisation for 11 years now, and I've seen a lot of changes, but this last year has certainly been the most challenging. I'm part of the wider communications team, and my focus is mainly on information, our membership journal, Quiet, research dissemination, and press and media using the sort of traditional channels. Now, the BTA has been around for over 40 years and has grown hugely in the last 5 or 6 years in response in the growth to demand for our services, and as we push for more investment in research. Now, prior to COVID, we worked, with the exception of myself, who was doing remote working before most of the rest of the world caught on. We worked from a small office in Sheffield, and from that tiny space, we tried to sort of tell everybody our vision, which is a world where no one suffers from tinnitus. And our mission in support of that vision is really to drive progress towards a cure, but also to deliver excellent support to help people living with tinnitus in the here and now. So COVID had an impact on us, as it did everybody, and also on the wider tinnitus community. Now, when lockdown was discussed towards the end of the second week in March, the senior leadership team were talking about pod working and a hybrid model. We didn't know what would happen, but we were preparing for that. And in fact, I was ready to pack my case to come up for the monthly team meeting, as was my routine. And I got a text suggesting that actually I didn't need to come up, and we completely closed our office on the Monday at 5 o'clock. So, like I said, at the time I was the only person working from home full time, so it was a massive, massive change for us. And people went home with laptops or PCs, and the senior team worked really, really hard with our IT and phone provider so that we could keep the basics going. So our email service and our web chat actually carried on without interruption. So we were able to support people through those channels pretty much seamlessly. And then thanks to the wonder of voice over internet protocol, our telephone system was able to be channeled through our computers. So within 48 hours, that meant we had a practical working helpline, although it did mean that changes to how we worked because of safeguarding concerns. So we were double staffing our helpline for a while. And within a week, we had resources on our website, information resources. So we were giving people information about healthcare services, how people might manage social distancing, how people might manage anxiety. Now that week was also the deadline for the membership magazine, For Quiet. And I'd felt quite pleased because it was all planned and in place, and it had to be completely reworked, and we brought out a special edition only a couple of weeks past the normal time, with all this kind of tinnitus and COVID-19 information. Then once the dust had settled a little bit, we continued to develop our information and our services, and we were actually able to carry on with our plans for growth and development. So as the year, months, weeks worked on, we were always updating our COVID information. So we provided information in response really to people's concerns, and this webinar is actually one of those, but we've produced more information. So for example, on working from home, what to expect from tinnitus services, information about the coronavirus vaccines and tinnitus, and there is now a corona and tinnitus FAQ on our website. And we've also been able to include people's real life experiences of living with tinnitus in a pandemic. So our services, some of you may be familiar with these, many of you may not be. Our services are self-referral for people with tinnitus and are mostly free. For some workshops, there's a nominal charge. And many of the services have been able to run with no visible change for people contacting us. Obviously, our in-person events have had to move online, and support groups are online. And we've arranged some of our own, but some of the independent groups have also arranged their own online sessions, or they're supporting people through social media or email. We've started new online groups to people who are new to support groups, to help cover some of the more basic questions before they enter more established groups for more in-depth discussions, as well as groups for professional musicians who are obviously very hard hit by the closure of venues and the change to the world, and for younger people. And we've had these new sessions for people with tinnitus, for people who are supporting people with tinnitus, so for tinnitus professionals. And we've got plans for more digital development and also for a chatbot, which is exciting. So a lot of the things we were able to continue as we always had done. Some things were new or were taken sort of online, but we've still been able to support people. And in fact, in the last year, the number of people we've supported has increased quite considerably. And although we'd always been experiencing year-on-year growth in a lot of the areas of our services, the pandemic really seems to have increased the numbers of people we're supporting, and especially online. In the year since March 2020, we've helped nearly a third more people overall. We really promoted Take on Tinnitus in the first months of lockdown, when NHS services were really restricted. And Take on Tinnitus is our sister tinnitus e-learning program. It's a free website, has information and resources in bite-sized chunks. It's almost like an audiology appointment on your PC, apart from you don't have a waiting room, and it's virtual, and you don't have a hearing test. That's about the only thing that's there. But it will give you the basics, and new registrations pretty much doubled compared to the previous year with that. Now, the other figures you can see on this slide are comparisons from March 2021 compared to March 2020. And you can see there's some quite substantial rises in all that. And we managed that with our existing team. And although some were on furlough for personal reasons, and we didn't have our usual volunteer base actually helping us take calls, although they were invaluable as sort of web chat support. So it was quite challenging to help so many people, but also quite rewarding. We'd found that people had more complex reactions to their tinnitus, and call length when we were talking to people was also quite a lot longer than it had been previously. And we think, this comes down to, and we were recording a number of effects on people living with tinnitus and the effect that the pandemic had on their tinnitus. And I think it became very apparent very quickly that almost everyone we spoke to was either experiencing a spike in their tinnitus or reporting tinnitus for the first time. But a lot of that certainly initially was people talking about spikes. And for many of those, just explaining the link between tinnitus and stress seemed to be really helpful, because I think people hadn't acknowledged how stressful the situation could be. And we worked with Eldra and an international team on a study looking at the impact of tinnitus on with the pandemic and lifestyle changes. And that research actually really backed up what we were seeing sort of at the sharp end. But I'll let Eldra speak about that shortly, and Kevin will talk about his work, which was actually with people who had the infection and were hospitalized. That was a group we weren't really talking to at first, because obviously they were ill, they weren't able to talk to us. So Kevin's work was really interesting when that was published. We had a very positive response to our new services and an appreciation that we were still there. A lot of people were really surprised that such a small organisation could still be available in the ways that we always had been. And I think the appreciation that we had was really heartwarming, when we were working, to know that we were working and able to help people. And I think the figures in the response to what people say about us speak for themselves. And I'm so proud to be part of an organisation which is able to do this. One of the interesting things I think we found from the response to our services and increasing our take-up is that we're attracting a younger age group to our services, but we're not losing older people either. I think possibly we underestimated people's willingness to go online and to use video calls or to use new technology. And actually, in events like this, with the automatic subtitling and the ability to read people's lips close up, accessibility is really improved. So if people out there are thinking, well, how do I access this support? Details are on our website, but this slide will give you our number and the ways to contact us. We're based in the UK, so these are UK times for Monday to Friday, 9 to 5. I know we've got some international people here with us. And if you are wanting to find out more about what we're doing, what new information is coming out, our social media is updated daily, more than once a day in many cases, and you can find us on those sort of places. So that's just a really brief introduction as to how the pandemic changed us as an organisation and what we noticed in some of the people contacting us. I think Eldra, who's going to tell us more about the research she did in that field, and also Kevin. So I'm going to pause now and hand you back to Maisie.
Thank you very much for that, Nick. It's always nice to be reminded. I think this year's gone so quickly. There's a lot of things that have happened within the BTA, which is always lovely to go over and really know how we've adapted. So I will now hand over to Kevin. Sorry, Kevin, I think you're on mute.
Wow, I wish I got £1 for every time that I did that. You would think I've never used Zoom before. Anyway, I was just saying thanks very much to the British Tinnitus Association for the invite to be part of the panel this evening, to be the token male on the panel this evening. So my name is Kevin. You can probably tell from my accent that I'm originally from Scotland. I've moved around the UK with careers and spent some time overseas, but I'm currently employed at the University of Manchester and live in Cheshire. My proper title is I'm a consultant clinical scientist, which really means I'm the sort of person you would come to see in an NHS audiology department as an outpatient for an assessment or management of hearing disorder or a balance disorder. And all of my career has been working in this field, sometimes within the NHS and sometimes within a university setting. When I was at school, which wasn't really that long ago, teenagers didn't know very much about audiology. Wasn't like a career that people would think about. And I only knew about it because I have a hearing loss. I have no measurable hearing in one ear. And it might have been something I was born with or mumps when I was younger. So it wasn't that I had a burning desire to work in audiology, but I had at least encountered it throughout my life. So it has actually shaped my career. And in fact, my wife is a clinical scientist in audiology, so it's shaped my family life as well. So you can't really escape things about ears or the auditory system when you live in the Monroe family. My current job, though, is not in the NHS. It's employed in the university. So I'm what's called a professor of audiology. And there aren't very many of us around in the UK. In fact, it's just possible that I'm the only currently full-time professor of audiology in the UK. So the sort of work I do is primarily research just now, research and leadership, I should say. And the research is looking at preventing hearing disorders, diagnosing hearing disorders, treating hearing disorders. And the people that I interact with on a daily basis might be people who are with a clinical background working in the NHS, it may be people who are teaching in a university setting to educate and train the next generation of clinical scientists and audiologists or other researchers. But no matter where these people are on the continuum, we all have this common goal of addressing the needs and improving the lives of people who have got a hearing disorder or a balance disorder. So most of my work has been human related. I did for a period of time do veterinary work. So I used to test the hearing of dogs as newborns, because there are some breeds of dog that are more prone to hearing problems. And when I lived in the south of England, we had this veterinary practice where we would do hearing tests on dogs, on puppies, tested thousands and thousands of Dalmatian puppies, and some dogs have had hearing aids and things, but no time for that anymore now that I'm busy at the university and busy with the family. Before the pandemic, I have to confess I knew little to nothing about coronavirus. I can't even remember, thinking back, had I even come across the term coronavirus at all before. And now my life is full of it, like everyone else's. So I've got to know that there already were 6 coronaviruses from hundreds that can infect humans, that some of them are responsible for the common cold that we get over winter. Probably about 20% of common colds are caused by coronaviruses. But I've got to know more about it, because I've had to find out more about it, both from my own personal point of view, but early on in the pandemic, people were contacting me, other professionals, asking me, could SARS coronavirus 2, the virus that's responsible for this disease that we called COVID-19, could it affect the hearing or cause hearing disorders, either temporary or permanent? I also had members of the public contacting me, and the press, so lots of media interest in this. And actually, there's very few health conditions that haven't been linked with coronavirus or COVID-19. We've been scratching our head recently trying to find some, but almost everything you can think of, somewhere along the way, someone suggested that it may have some connection to the virus that's causing this pandemic we're living in. So, as of today, there's been something like 170 million people who have been diagnosed with COVID-19. So very big very big numbers. Anyway, over the course of the year, I've had to learn about coronavirus, and we've carried out a number of studies, have a number of publications. Actually, since this is about tinnitus, it's just reminded me that the very first academic publication that I was named on was about tinnitus. It's when I was working in Scotland, and it was at a time when we were setting up what we called tinnitus clinics, where we put time aside just to deal with people whose primary concern was tinnitus. And I think once we'd tested or worked with 100 people, we wrote an article for a Scottish health magazine called the Scottish Health Bulletin, if I remember correctly, talking about our experiences. So interesting, that's where it all started. And I think over the course of this evening, I might have the opportunity to tell you a little bit more about the coronavirus type work we've been doing. My area of expertise is quite focused. So when I'm responding to a question, if it's something that I think is within my area of expertise, I'll make it clear. Otherwise, I'm really just a reasonably well-informed member of the public like anyone else. Thanks.
Thanks very much for that, Kevin. And the job that you had working with puppies sounds like the best job in the world. So thank you very much for that. Moving on to LJ.
Great, thank you very much for the invitation and for having me. And I was actually one of Kevin's students at a stage, and I specifically chose to go to Manchester just to be with Kevin. So he's really one of the audiology heroes out there. I
think someone's paid you to say that, Eldry. I didn't know that.
Oh. So I've got, I just also made some slides. Can everyone see those?
Yes, yeah, I can see those. If you could just pop up to slideshow, it should appear in, there we go, perfect. Thanks, LJ.
Great. So I think I've got quite divided jobs. I juggle between them, probably not very well. At the moment, a lot of my role is doing research, but I also work clinically as an audiologist and also lecture some students. So really juggle between those. And how it really started is I just started working as an audiologist, and it's quite a complicated field in that you can't, they're all kinds of different problems, and you don't always deal with all the problems, and you have to build up your expertise in different areas. And one of the sort of more specialized areas is tinnitus work. And it took me quite a few years of experience before I was almost allowed to work with people with tinnitus properly. And I started working on these more specialist clinics. And I think during that time, just realized that we need a lot more, we could do a lot more with people with tinnitus. And that got me thinking a lot about how we can improve our service provision. And I then attended a talk on internet interventions in 2014, and that Gerard Andersson from Sweden gave. And that really struck me as something that we could use that could really improve our tinnitus services. And that led to doing a PhD with the aim of improving access to evidence-based tinnitus care and making this care accessible. So I think that's been a main aim of my work. And back then, everything's on the internet now and everything's remote, but then at that stage it really wasn't. Especially in the UK, most care was seeing someone face to face, and that's the model we were using. So I was met with quite a lot of barriers because it wasn't something that was happening at that stage. And I think my current focus is still on trying to improve outcomes for patients and improving service provision. So, in different ways, both in equipping audiologists and looking at patient outcomes. So why I was interested in the COVID research was, to me personally, I think the think life is so busy. I'm not somebody who knows anything about the media. I'm always the last person to hear any gossip or, know what's on the media. It's always old news by the time it comes to me. So I was probably behind on the news with all the sort of COVID related stuff. So it came to me as quite a shock when everything suddenly closed down, because I had this full diary and I was just planning everything I had to do. And suddenly this diary was just, open. I just looked at all these things that were going to happen that week and they were all just suddenly cancelled. And I realized that, working with so many people with tinnitus, that it can really be exacerbated in stressful periods. And I was concerned about people with tinnitus. And I also saw an influx of tinnitus referrals, despite healthcare basically being closed. So I was worried about the tinnitus population, and I remember discussing it with sort of a few of my colleagues, and I think a lot of people came back with mixed reactions, and it was quite a difficult point of time to do research as well. But eventually, we got a team together that said, okay, let's do it. And everyone's hypothesis about what we would find was quite different, which was interesting. But I think that's the nature of tinnitus. For some people, we did think the world is different. Some people are at home, it's maybe quieter, maybe that's better for them. But for other people, being at home where it's quieter may be worse because they're more focused on their tinnitus. So you do have, exactly the same situation could be a positive for one person and a negative for other persons. We really didn't know what the research was going to show. And we can talk more about the research done. But when I was trying to plan the research, I came up with 10 questions. And it was trying to look at the impact, firstly, of COVID on tinnitus, but also the impact, quite importantly, of the pandemic on tinnitus, because I realized more people are basically exposed to the pandemic than would be exposed to COVID. And then also what we could learn about coping with tinnitus during the pandemic. So although it's a terrible occurrence, the whole COVID pandemic, we need to, as researchers, always be thinking, what can we learn out of this situation? So a big focus of my research has been on that aspect. And then also how we can improve services. So I think that's also a big focus of mine, is taking the situation and looking what can we learn from it. How can we better support those with tinnitus? And the BTA are a shining example of how they've adapted to be able to meet the needs almost more widely in different ways. And so that's what my research focus has been around during the pandemic, and we can discuss more about that later. So I'll just stop there.
Thank you very much for that, LJ. And then moving on to Henri.
Hi, just let me share my screen. And here we go. So can you see my screen? So my name is, so thank you very much, Henri, for British Tinnitus Association for having me speak on this important topic. My name is Henri, or Henrietta, and I'm the founder of I Am Ear, which is a private audiology and hearing therapy practice in London. I have been in the audiology for the last 15 years in the private sector as well as the NHS. And I specialise in hearing therapy and hearing amplification. So I specialise in tinnitus, misophonia, and all the associated hearing difficulties, and giving the best tailored hearing solution for each individual. And I also run 2 monthly online support groups for the British Tinnitus Association. And Emily has asked if I want to do a 3rd one. So let's see what happens there. I just wanted to say I have a slightly different, because I actually had sort of COVID during lockdown. So I have tinnitus. I've been a tinnitus traveller all my life. And I had COVID just before the first lockdown started. And I actually came out of quarantine the day of UK lockdown. I had moderate COVID symptoms, and it took about 2 months to get over it. And I was put on to furlough straight out of quarantine. I went straight into furlough, and I was unable to contact any of my patients to offer them support until sort of like 5 months later. So during that time, I noticed my tinnitus was increasing to the point where I actually had to do tinnitus management for myself. And I came to the conclusion, if I'm struggling and I'm a hearing therapist and I've had tinnitus all my life, what about those people out there? And so I contacted the BTA, and I was like, can I help people? And so I started my kind of journey with the BTA. And so I'm slightly different to the others because working in the private sector, I was able to see patients so I wasn't able to see my private patients, but I was able to see urgent ENT with the private sector patients during COVID. And when I came back to work, we had more referrals, both from ENT and from self-referring patients, because I couldn't find help by the NHS at some points. And it was very tough. People came in for appointments to have hearing tests or for us just to check their ears, because I couldn't get GP appointments. And then we tried to do remote sessions with them as well. And we also noticed that some of the ENT support for the NHS wasn't there. So pre-2020 in London, a GP could refer people to an urgent ENT referral. So if you had distressing tinnitus, your GP could refer you to somebody. And then during lockdown, most of these clinics stopped. And we noticed that with patients. And lastly, with me, is there was an added stress of insurance companies not paying for tinnitus, not covering tinnitus or hearing therapy. So patients had an increase of anxiety about having to pay for treatment. So in regards to increased tinnitus, not only was there an increase in tinnitus patients, but we saw more people with anxiety, more depression, more stress. And there was also a report of impact of isolation. And there was an increase in scoring on the hospital and anxiety depression scale. And we were referring people to other professions for underlying conditions like depression, from bereavement. So there was lots of other things that people were dealing with. And in regards to pastoral approach, how we were managing our patients changed as well. So not only were we doing the traditional hearing therapy approaches of CBT and mindfulness, but we had to bring in the effect of lockdown. So working from home was a big thing, getting them to have screen time versus break away from screen time, because people were spending 7 hours just facing the screen and then wondering why they were so tired. We had finding new habits for people to do at home. So because all their habits had gone from going out, hanging out with their friends to going to cinema. So we had to kind of find ideas of making them distract themselves. And we also had to increase the noise in their life, because people had gone from a noisy, busy life to silence of their home, which increased their tinnitus. So we were trying to kind of work on different things to help them. And we've got an increase of people reaching out for information about how to access tinnitus information. And I had more emails from people from abroad and from around the country looking for solutions. So my emails went from come in and see me to here are all the free things that are out there that can help you during this time. And it was really interesting to see that shift. And then the key takeaways from this is online and offline in a blended approach. So some people wanted to come in, some people didn't want to come in, the fear. And I'm still doing that today. I'm having people come in and not come in. We need more accessible treatment and information for tinnitus travellers. So a lot of people don't know about the BTA when they contact me, and I'm always sending people to the BTA website and saying, here's some information. And that's most of my follow-up emails that are as well. The BTA has all this information. Go, they're amazing, go see them. And the other thing is that I've noticed it's going to take a while for the NHS and private practice to reduce their waiting lists. So even now with the NHS opening up, still people's waiting lists to see their GP or their ENT about their ears is still quite long. So, and then we talk about tinnitus management. So the importance of mental health over the last 14 months has been really apparent. We have to, the stress, the anxiety, dealing with COVID and everything has a massive impact. And also, I always call it the backstory approach to managing tinnitus. So we have, if people's interaction with their lives have changed because of COVID and lockdown and the future, then we have to change how they interact with their tinnitus as well and give them new strategies to cope. And the others will talk about it, but the indicators for long COVID and tinnitus are there. And tinnitus, unfortunately, in general, is set to rise. So that's not a great thing as well. But in a good way, the research is coming. So hopefully with research comes more information. And I say moving forward, what we can learn. So I always say the importance of support sessions like this, the webinar, the support groups that Nick talked about, so getting information out to patients. And the importance of tackling the whole person, not just tinnitus. As LJ was saying, there's lots of things going on with a person. And if we just focus on their ears, we're not gonna get them the complete treatment they need. We need to have an online, offline approach in treatment. So we can, when England starts opening up and people want to come back in, they can, but also have the ability not to come in if they don't want to. There's obviously an emergent impact of long COVID and tinnitus. And I know that the BTA are now creating a database of urgent ENT referral procedures in the NHS. So hopefully then if you're in, I don't know, Cornwall and you suddenly get distress from tinnitus, the BTA can go, this is what your GP can do to get you to see an ENT person quicker than normal. So yeah, and that's me very, very quickly. So I apologize if I rushed through it and I sped up, but thank you very much. So, and I will pass my screen back to Maisie. So,
thank you so much for that, Henri. That was really, really useful, actually. And yeah, there are a couple of points on there that we'll definitely touch on during the Q&A. So we will move on to the questions. So thank you to everyone for submitting a question during registration. As you can imagine, a lot of these questions are around the same topic. So we've just kind of collated these together and we'll put them to the panel. So starting with probably the most popular one, and I probably know the answer to this one because I believe there is a lack of research at the moment due to the speed of the vaccine being drawn out. So the first one, will the vaccines available affect tinnitus? If so, how? So do we have any volunteers for that first question?
I can start to make some. Oh no, on you go, Nick, please.
Okay, well, I was going to say we looked and we followed this very closely, as you can imagine, and the initial results that came out of the studies that were undertaken with all the vaccines were showing that there wasn't an impact with tinnitus and with hearing. And in fact, the initial research paper for the AstraZeneca vaccine, I think the only impact that anything ear related was out of 40,000 people, it made 3 people's ears turn red. So initially we weren't concerned, but we've obviously followed the impact through the Medical Health Regulation Authority website and the information that they put out, which is freely available for everybody. You can go and have a look yourself. And looking at the figures, there's potentially, people can report anything that they feel may have been triggered by their by their vaccine. But looking at the numbers, people who are affected with any kind of hearing related change after the vaccine, the numbers are very small compared to the numbers of people who have been vaccinated. So but these are reports from people, you know, they've not been double checked by medical professionals, they've not been confirmed, they've not been followed up, so that if somebody reports a change and then that change resolves, that's not recorded in these records. There's, you know, there's no differential between people's having onset of tinnitus and tinnitus increasing. They're not differentiated. So the real answer, and I think Kevin's about to probably would be saying the same, is that we don't actually know for definite.
Thank you. Well, you know, although the pandemic's been on the go for a year, it kind of feels like we're on a journey and we're still at the start of this journey. So, you know, we have to be completely honest and say there are some great questions. This is a very important question, but we really don't have the answers yet. I mean, people have contacted me who say after they got the vaccine, they have tinnitus. And in the majority of the cases, the people who have contacted me, it was transient. But there are also people who have told me that after they got the vaccine, they were less troubled with tinnitus. And in discussion, we've assumed that, you know, people have been a bit anxious during this pandemic, and it's a bit of a relief when you get the vaccine, and that might explain why the tinnitus might still be there, but it's less bothersome and troubling for individuals. I mean, it's absolutely no secret that vaccines are one of the few things in medicine or healthcare that has really revolutionized the world, right? There's lots of things that happen in hospitals and you think, well, the evidence is not strong. It absolutely is categorical for vaccines. That without vaccines, you know, we still have things like smallpox, we still have big numbers of children dying, we still have people living with lifelong disabilities. So vaccines in general are a good thing and rarely have long-term, the evidence so far, rarely have long-term adverse events. The situation now is slightly tricky because two things. A number of years ago, a doctor called Andrew Wakefield made the misleading claim that the MMR vaccine that children do get might cause autism, and that caused immunization programs to fall, and this sort of anti-vax movement began, and he's been completely discredited, but the seed has been sown. And I can also completely understand there are times like now when people say, how can it have been rushed through so quickly? We must have cut some corners and that there must be a risk. I'm not an expert in this area, but my understanding is adverse events tend to show up relatively quickly. So the chances that there could be something coming along later on, that we clearly can't rule it out, but the odds would be against it, to be honest. I've had the vaccine and the booster, AstraZeneca in my case, my wife has had it, Pfizer in her case. When family and friends have asked me, I've said, absolutely, without a doubt, you must get the vaccine. You weigh up the risks and the odds, there's a clear winner to my mind, and you should get the vaccine. Just finishing with this point, the one thing that makes it particularly difficult right now at knowing has the incidence of tinnitus increased is because the number of new cases of tinnitus is always very high. And our best estimate is something like 1%, 1 in 100 adults every year will newly report tinnitus. Well, if you take the UK population, that would work out to be about 500,000 adults a month. Now, when you weigh up 500,000 people a month on average are going to report new tinnitus, and then say, is it any higher because of COVID, because of the vaccine? You can immediately see the problem that we have, that we've got this big number to start with. So clearly a lot more work has to be done. I don't think we're going to get an answer in the short term. It's going to take a longer period of time. But my view is that, you know, when you weigh up the potential benefits of having the vaccine, I've had it, I've told all my family and friends, definitely go for the vaccine.
Thanks so much for that, Kevin. Yeah, and it's so important. I think it's also important too, and this is obviously just from personal experience, and this might not be the case for everyone, but there are symptoms. So there are symptoms of having the vaccine, flu-like symptoms, and we do know that tinnitus is linked to feeling unwell. So it may just be, there's just another number of reasons there, and anxiety around it as well. As you say, it happened very quickly, and I know Nick knows more about this, but there's been media around the vaccine, and yeah, I don't think that's necessarily helped when it comes to factual information. So yeah, I think it's a very, very good point. The next question talks about more of the stats of each vaccine, and is there one better for those with tinnitus? So maybe those that haven't been vaccinated yet, is there, with the evidence that we currently have, is there a better vaccine to have for those with tinnitus?
Having compiled the stats for the BTA website, because the stats, if you look at MHRA information, they are broken down by vaccine. I think that was a question that somebody's raised in the Q&A. And they are very much of a muchness. And sometimes this does also seem to depend on the country, because looking at the stats in this country for Pfizer and Moderna, the numbers are slightly different in the US for Pfizer and Moderna. They don't have AstraZeneca. So it's really difficult to say. I think, I'm afraid, again, it's another we don't know. MHRA are very clear that the numbers aren't to be used for incidence calculations. I think when this is probably all over and the official approvals of these vaccines are done and the numbers have all been crunched, we may know, but equally we may not, because they may decide to focus on the really serious and sometimes fatal side effects from vaccines that have been alleged. So we don't know.
Thanks for that, Nick. Just to follow on from that, you mentioned the websites there to get relevant information, and I've just noticed a question in the Q&A box asking if any of our panel could put pressure on the NHS yellow card scheme to include a question about existing tinnitus being worse rather than new tinnitus post-vaccine. So it's one of those. I can't imagine anyone can put pressure on anyone in regards to the yellow card scheme, but does anyone know any maybe the direction to go to maybe recommend an amend to this?
Well, I have a comment to make, and it's not specific to the yellow card scheme, but the point is quite important. Is it, if you're measuring these things, can you be sure, has something changed? Is it new tinnitus, or has existing tinnitus deteriorated? And one of the issues when you look through the literature, and this is really looking at evidence that there might be an association between COVID-19 and tinnitus or hearing problems, so not specific to the vaccine. Sometimes it's very hard to understand, have the researchers carefully teased these things apart? Because if you don't answer it carefully, there are going to be high numbers of people that will say, yes, I have hearing problems, and yes, I have tinnitus. So you have to be very careful how you answer the question. That's just a general point I'm making. I don't know very much about the yellow card scheme. I know there's something very similar in the USA. It isn't really set up for doing this sort of thing. So you don't get the information about, is it a male, is it a female, was it a transient symptom, did people have several symptoms, was it when you were feeling grotty, 24 or 48 hours after having the vaccine. Unfortunately, it just isn't set up for doing that sort of thing, which means any data you get from the yellow card scheme is very crude, and there's no controls. We could equally say, let's just ask people over the last week if they've had tinnitus who didn't get the vaccine. We might well see some changes there, and it's looking for that excess numbers that we're really interested in, and you just can't get that from the yellow card scheme. So I know people have looked at this before to think, can we do some research with the numbers from the yellow card scheme? And to be honest, it seems so crude that actually people are put off from doing any research. So it can be helpful to see trends in much the same way as looking at social media and people start talking about these symptoms. It can be helpful just to start to see trends that can guide us when we want to do research. But I think the general point is, anytime we're asking these questions, whether it's to do with the virus or the vaccine, we have to be very clear how we word the question. So is it a change or something that's already existed?
Yeah, no, that's a very good point. Sorry, Nick.
Yeah, because I was going to say, I don't think the form actually asks questions in that way. It is self-report. And what is quite interesting, I guess, if you're into the numbers, is that most of the cards are reporting more than one adverse reaction. So, for example, you may be reporting tinnitus, but you may also be reporting nausea or diarrhea or aching joints or swollen glands, because most people are reporting more than one symptom if they're reporting an adverse reaction. So it's not something that's necessarily being recorded in isolation.
Great, thank you. Would you still, just following on from that comment, would you still advise people to obviously complete the yellow card scheme if they are experiencing symptoms? Just because I appreciate, obviously, like you say, that the data is not maybe accurate enough to carry out research from. However, it is still important to obviously note those symptoms that you're experiencing.
I would encourage people to do it because I think it's very important to keep hearing disorders and tinnitus on the radar. If you look at the money that's, well, if you ask people their perceptions of how common do they think particular illnesses are, they will say things like cancer is very common, cardiovascular disease is next on the list, and then hearing problems. Actually, that's completely the wrong way around. You're much more likely to have a hearing disorder, and you're much more likely to have a cardiovascular problem than have cancer. And this misperception about the prevalence and the risk quite possibly influences government policy. So I think tinnitus and hearing loss always seems to be well down the agenda, right? Because usually it doesn't kill you. But you know, there's got to be more to life than avoiding death, right? It'd be a rather miserable existence if that's all we're trying to do. So the quality of our life is very important. Less than 1% of the UK healthcare budget is spent on hearing services, and less than 1% of UK health research is spent on hearing problems. So I think it's very important, especially with a growing and an aging population. The term sounds a bit unpleasant, but the burden that's associated with having ear problems is getting higher all the time. So I absolutely would say that everyone, every opportunity should be mentioning these things to keep it on the radar so we can get more funding for doing research into things like the impact of COVID and the vaccine on hearing and hearing disorders.
Great, thank you. And just on that topic, do you think, with obviously the talk, there's been a lot more talk about tinnitus in the news and newspapers and things, and do you think there is room there for more funding, and it's been put on the map now?
It's a question for me?
To anyone, to the whole panel, yeah, just following up from that, because I definitely have seen a lot more news articles, whether they're accurate or not, but they're mentioning tinnitus, and I think, yes, some of these do have negative impact on people with tinnitus and cause anxiety. However, I think it is still very important that it's been talked about, because I've seen it a lot more in the past year than I have maybe in the last 5 years. So yeah, I just wanted to get people's thoughts on that.
So a concern I did have as head of a research group was that because of the pandemic, the funding that might be available for the things that interest us might dry up, that all the money would go in a different direction. And many charities have, you know, suffered terribly during the lockdown, and the charity shops have been closed and things. So even some of the largest charities in the country have had to reduce how much money they can invest into research. There are research studies that are completely relevant, and Eldri has done some, and hopefully we're going to be collaborating and doing some more. So I think we are going forward. There is some funding. I think there is an appetite in the UK to fund more hearing research. The government recognise that actually there's this huge burden, the number of people who are living with hearing disorders. And we had a government roundtable, so a discussion meeting that all got delayed because of the pandemic, but it actually ran in December using Zoom, where we had some very influential people from the government present and charities, and David Stockdale from British Tinnitus Association was present. And I think there is an appetite for more money to get directed to our area, but that's very easy to say, and it could easily get absorbed and lost along the way. So everyone has to keep pushing and prodding. But I am feeling more optimistic now than probably any time in my career that our area is being recognised and funding is starting to come along.
I was going to say something as well, because I deal with hearing aids and obviously fitting hearing aids with tinnitus. I'm seeing a lot more research that the hearing aid companies are doing in regards to getting better hearing aids and hearing aids for tinnitus. So that's coming as well. So it may not be us doing it, but they're also researching the tinnitus and hearing aids, which is quite interesting. And they're having apps on their phone for tinnitus, and they're getting, and yeah, so it's a really interesting thing for me, because 7 years ago when I joined the private practice, there may be one hearing aid that you could fit nicely to a tinnitus person with hearing loss. Now all of them are doing it. So yeah, and that's research that's happening as well.
It's really interesting, especially I think I've seen a lot more kind of apps on a certain Amazon product. I don't want to say their name in case I set anyone's off at home, but the app's available on there. They're becoming a lot more accessible, and obviously a lot around mindfulness and relaxation, which is probably, again, related to COVID and people being told they need to look after their mental health, which there again is a link there, which in turn could potentially impact the tinnitus in a good positive way. Just obviously the vaccine was a very, very popular subject in the questions being asked, and I appreciate that there is very little or no research yet carried out on around the vaccines, because it has been a very quick process. It's a lot quicker than I certainly thought that it'd be rolled out. So I just wanted to ask the panel if they're aware of any research into the link between the vaccine and tinnitus, if they know of any research coming up in the future, or they've heard about.
I wondered if Eldri might want to raise the sort of discussions we've been having recently on how we might take this forward. Eldri, would you be happy to say something?
Yeah, so I think I also started getting more and more emails from people saying, I've had the vaccine and I got a spike in my tinnitus, or it initiated my tinnitus. And people sending these Facebook groups where they're saying people, it's happened to other people. And people asking that same question. I've had one, what do I do now? Do I have the second one? Or people that haven't had theirs yet, and do they go for it? And I then contacted Kevin as well and said, we really do need to try to look into this. It's very difficult to capture. And I think with research, Kevin always really emphasizes that you need to have a group where there's a control group, and that's getting more and more difficult because there's so many people that have had the vaccination. And I think when we started hearing these reports, we were almost too late jumping on, and then it's trying to get funding and ethics. So it's really hard to capture these things at the right time. But it is something we are hoping to look into a bit more, because we really do want to try to get some answers to these questions, and to do it in a way that hopefully the research is slightly more robust, that we do have control groups as well. So we are trying to look into doing some of that research, but it hasn't quite started, and we don't know of any existing research, except maybe some surveys that are going out, just asking the general tinnitus population if they've had the vaccination and what effect it's given.
Thank you very much for that, LJ. Yeah, I think it's just one of those, isn't it, at the moment? It's just so new, and new symptoms are being reported as well. And yeah, no, it'd be interesting to see if and when the research will be carried out in that. And I suppose it would rely on accurate information. Like you mentioned, Kevin, the yellow card scheme may not be the best to use in that research. Just touching on something, Henri, I know you mentioned around the ENT waiting lists, and obviously if someone is new to tinnitus or their tinnitus has spiked over the past year, and they've contacted their GP and asked for a referral, I think it's very daunting hearing that there's 3, 4, 5 month waiting list. What can people do in the meantime whilst they're waiting for their ENT? Because it's for someone new, maybe someone younger who thinks tinnitus, that's it, that's their hearing gone. That's not necessarily the case, is it?
No, I think information is a key aspect, and that's when I would say send to the BTA website. As Nick mentioned, the Take on Tinnitus is a really good kind of source of information just to get you to understand what's going on with your ear. There are also we do the BT online support groups, and a lot of people are finding them really helpful because they're not alone. Because tinnitus, you feel like you're alone when you've got it, and it's this noise that you're never going to escape. So if you find people who are also going through that, then you don't feel like it's as scary as it is. There's also something called Sleep Station, which is if you write Sleep Station NHS, it's a free online service that's that you can get to help you with your sleep. So there are things out there that you can get support with while you're waiting to get to the ENT appointment or your GP appointment. I would say I still go and see them, especially if you've got one-sided tinnitus or one-sided hearing loss. Then you should try and go and see somebody and get some hearing tests. I do know there's the private sector, and we can always do hearing tests for you. I'm always very reluctant to say that, because I know that there are some people who then end up selling loads of stuff for people, and it ends up being more about what they can purchase than what the information. So I even had someone today, they came in and they were like, in the first 5 minutes of seeing you, you've told us more about my ears than I have in the 6 months I've been with somebody else. So it's the information. And yeah, and I would say the only reason why you would go to see an ENT consultant is to check your hearing tests, check to make sure there's no wax in your ear and make sure your hearing is okay. But yeah, there are loads of online free support out there for you to get you through until you get to see your ENT consultant. So you're not alone.
Thank you very much for that, Henri. And it is worth mentioning, if you do feel like you want to attend a support group, but don't necessarily want to be involved in the first instance and just want to observe, do let us know, because you can join and just see what they're about before getting involved. I think it's also so important to know that I think one of the biggest issues is someone goes to their GP, talks about their tinnitus, and they don't have enough knowledge to advise. So the common line that's used is, there's nothing you can do about it, it will be there for the rest of your life, which someone first experiencing that is scary, very scary. But they can ask to see for a second opinion, can't they? And we do have a webinar on our website, actually, which you can watch if you're interested in that. And it just gives you a few tips of what support should be offered to you at your GP appointment, which is really useful. So just moving on to some more questions. I appreciate a lot of the questions are around the vaccine, which we don't have enough evidence to advise on at this stage. But if someone has received the vaccine and they're experiencing troublesome tinnitus, so it's intrusive for them, would you advise them to go through the process still of seeing their GP? And
any changes to your tinnitus or any kind of new tinnitus, the procedure before of the lockdown was to go and see your doctor, and they would refer you to ENT to get it checked out. So I'd still do that process, but do you understand the GPs are a little bit overwhelmed? So if they don't get back to you, I would still contact them and just keep that up. And I think as well, just having a list of what your symptoms are. So when you go to your GP, you can go, this is what I've got, is more useful for them, because they may ask you a question and you end up going down a route, and then you walk out going, oh, but I was talking mainly about my left ear, but I also have it in my right ear, or I have dizzy spells, or I have problem with loud sounds, and I didn't mention that. So that's why it's always useful to kind of say, this is what's going on with my ears. Yeah, and hopefully they can open up and check your ears and just make sure you don't have any wax, because it could just be as simple as you've got wax in your ear, and you're hearing your ears because you can't hear from the wax.
It's a really good point. And I remember on a webinar recently, a retired GP did say, if you are wanting a little bit more time with the GP, appreciate appointments are very limited at the moment, but if you did want more time, you can book a double appointment. Obviously that's not offered for everyone and it may not be available to you, but it is definitely worth asking if you want a little bit more time with your GP. Thanks for that, Henri. So just moving on to hearing loss and tinnitus. So is there a link between hearing loss and or tinnitus and COVID? If so, what are the results of this? Looking at you, Kevin.
Yes, I'm happy to answer that question. I just wanted to pause because I wasn't sure if Eldri wanted to say something. Let me, since the microphone's on, let me carry on talking. So we know that this virus that's caused the pandemic is more than just a respiratory disease. We know it affects all sorts of organs and systems throughout the body. And it's well known that some viruses can damage the auditory system. So it's an obvious question to ask, is this particular virus causing any problems with our auditory system, changes in hearing or tinnitus or vertigo? Really, we were motivated because so many people were asking us that question that early on in the pandemic, over a year ago now, we decided, let's just search the literature and see what has been published already. And we're looking at all the different coronaviruses that we already knew about. So things like SARS that came along in 2002 and MERS in 2012, was it? And we did a search. We found no evidence that any of the coronaviruses that we already knew about was associated with hearing problems. But we did, even last April, came across a small number of articles, about 7, that were saying there's a potential link between the virus that's causing COVID-19 and hearing loss and tinnitus. There were 7 articles. Some were case studies, often just a letter in a journal, so not very much background information. But we were surprised, actually, that even so early in the pandemic, that there were things already being published. Now, the quality of the evidence back then was not especially high. And what I mean by that is not being critical of the individual studies, but when you want to say how confident can we be that the findings from these 7 studies are enough for us to say, yes, it's definitely causing a problem with your hearing or tinnitus, or it's not, was relatively low. So the next thing that we did was to ask people who had been hospitalized because of the severity of their COVID-19, if anything had changed. So there's a hospital just about a mile outside my window here, a big respiratory centre in Manchester. And we followed up 121 adults who had been discharged after being in hospital because their COVID-19 symptoms were so severe. Now, when these people are discharged, they automatically get a review appointment and they're automatically followed up. Happens about 8 weeks after they were discharged. So they're chest physician contacted them, mostly done remotely because of the lockdown, but also some of these people were still, you know, fatigued and breathless and not overly excited at the prospect of coming back to a hospital. So it was done remotely, all sorts of questions about, as I say, breathlessness and fatigue. And in amongst them, we asked questions about if anything had changed with their hearing or tinnitus. So it wasn't me that asked the questions, it wasn't anyone with a hearing background who has a vested interest in potentially looking at getting a particular response. And the outcome of that, of the 121 adults, was that just over 1 in 10 said either their hearing had deteriorated, or they now had tinnitus, or their tinnitus had deteriorated. So we kind of sat up and took notice, thinking 1 in 10, that's potentially very big numbers, and that could have a big impact on society and on hearing services, NHS services. But the important point to make is we didn't have a control group. And what I mean is, we didn't ask people who had been in hospital seriously ill without COVID, had anything changed with their ears. And it's just possible, if you've been very ill and in hospital, that when you come home, you have some ongoing or lingering symptoms. So we didn't have a control group there. Anyway, to kind of cut to the chase, we decided to repeat our review of the literature. And we did that actually on the 18th of December was the day that we searched all these libraries to see what has now been published. That article our review got published about 8 weeks ago. So by the middle of December, there'd been 56 articles published that was relevant. And half of them were, again, individual case reports or small series of individuals. And the other ones tend to be like a cross-section of the population where they were asked on a questionnaire to recall if it had tinnitus or whatever. So I can tell you from a hearing point of view, there were a number of studies. Something that stood out was a sudden deterioration in hearing in one side. And actually, when that happens, that's really considered a medical emergency. People often don't treat it as such because they wake up and think, I've got wax in my ear, and days go by before they go to their GP and whatever. But a sudden change in hearing in one ear, unexpected for no other reason, is a medical emergency. It's normally treated with something called steroids, which are designed to reduce swelling and inflammation in your ear, and that has to start quickly. But even the difficulty there is, we know that about 10 people in every 100,000 get a sudden hearing loss every year. So is it just an incidental finding that when these people had COVID, that they had this change in hearing, or was it caused by the COVID? So I'm not at all dismissing it, but these are the sorts of challenges we're faced with. Anyway, we pooled the studies, and our best estimate was that around about 7% of individuals with COVID were now saying their hearing had changed. They now have a hearing loss or it had deteriorated. In statistical terms, we talk about confidence intervals, saying how sure can we be about that 7%? And actually it's quite wide. It goes from about 1 or 2% up to 15, but that's our best estimate right now. Tinnitus was the highest. It was about 14%. Again, wide confidence intervals, and then also vertigo, which can be caused by your ear. Now, we published that study. It's had lots of media attention. But we've actually followed up the authors just to be doubly sure about what they've said in their publications. And I have to say, even publications where it looked absolutely crystal clear that the researchers were asking about, has there been a change in tinnitus? Is it new or has it deteriorated? This goes back to the question that someone raised earlier, and I said, you have to be absolutely clear. The response to our email inquiry makes us think, actually, maybe they weren't as clear. So I think, if anything, the numbers are going to be revised down a bit. So our best estimate right now is there is this association that people are reporting problems. We generally don't have control groups. We don't know if we'd asked a group of people who didn't have COVID what it would look like. And that's leading us to our new research studies that we're just starting and ongoing. And if there's a chance, I can say a little bit more about that further on. But Eldri might want to say something on the topic. Or maybe not. You're muted, Eldri. You've nothing to add? Oh.
Okay, sorry, I don't. My button just kept pressing. I think what I've tried to look at from these studies that have been published is there anything that seems to link things together? Like Kevin was saying, for some people, some of these publications, it was just single case studies. But then even in those, they sometimes had a bit more detail, say tinnitus was only in the right ear, or tinnitus was only in the left ear, or tinnitus was in both ears. And sometimes, so I thought, if I looked at all of those studies, is there a pattern? Can I pick up a pattern that most of the people reporting tinnitus post-COVID, that it was only one ear or both ears, or was it generally associated with hearing loss and vertigo, or generally not? So that's what I try to look for. And then also, if the tinnitus stays, or if it seems to go away after some time. And from the publications that are out there, although like Kevin said, there are quite a few, I couldn't find a pattern at all. So where they were reporting things, if it was only one ear, some people would be right ear, some people would be left ear. Very few of them followed up. And I think it was just the stage of the publication, you know, we found somebody, or we found some people, so they published that, but they didn't follow up, and I don't know if they are all following up longer term. So that's one question we really don't know, is how many of these people that did report tinnitus and hearing loss, you know, how many of these people still have it a few months later. And so from the publications, like Kevin said, I think hearing loss is to a lesser degree than tinnitus, and vertigo still lesser degree. So tinnitus is definitely the one that seems to be most prevalent. But from what's out there and from what I've heard from people, it's very different for different people, which is just typical of tinnitus. There is no pattern to it, and it would be obviously so much easier if everyone had the same kind of presentation. But just this varied presentation makes it so much more complicated, and makes drawing different conclusions and associations also, you know, more complicated. So while some people getting the hearing loss but not tinnitus and not vertigo, and some people are getting all three, some people are getting two of those symptoms, because if you're thinking it is just inflammation in the ear, then, you know, you're thinking maybe they'd have more. So it's very interesting that it's so variable.
Yeah, I think it's interesting that you raised a point there about, is it going to stay around, or will it go away? Because that was a very popular question that was submitted, is those people that have experienced tinnitus after their vaccine, the main question on their mind is this just a temporary thing, or is it going to be permanent? So I imagine from, again, there's not enough research there, but is there any kind of evidence around that could link to?
There's been both reported. From what's published, there are publications that say tinnitus was there and it went, but different periods of time, that it went to some quite short, it was just there a short time, other people saying 2 months later, and other people I think have read that it can go, and they so patients and are hopeful that it will go, but it's still there months later. So I'd say very few of the published papers have any information about how long the tinnitus has been there. So that's definitely a gap in our knowledge. And those that have published, it's very variable. And I think the same for the patients we've heard from. So some of the emails and patient contacts for both the tinnitus post-COVID and post the vaccine. So I've had people that have written, said, oh, I had the first vaccine, I really don't know what to do about the second one. And a few weeks later, they've said, oh, you know, my tinnitus has gone away now, so I think I will have the second one on, you know, thinking through it. So just taking not just the research, but the general information I've got, I think there's a big chance it can go away, but that's not the case all over for everybody, definitely not. And it might be how tinnitus is managed, which if it was in a world without COVID and without the pandemic, if you got tinnitus, 2 people got tinnitus, for the one person, they might just not really notice it and carry on. And for the other person, it's going to become a big problem. And that's probably part of it is just how it was managed. And with the research we did, part of what I looked at is help seeking during the pandemic for tinnitus. And that showed a huge decrease in help seeking from the people we asked, and that was globally. So I think maybe the BTA got a lot of responses, but I think not everybody, especially outside the UK, had that kind of support and knew who to ask. And those people, possibly their tinnitus is still going to carry on post-COVID or post the pandemic because they feel so hopeless and don't know where to seek help, where some people that maybe have accessed some form of help, their tinnitus gets better. And I guess on that point, what the general progression of tinnitus overall in time is generally that it does get better. There are times it can spike, but if you look at the overall pattern in time, things should get better and improve more so if they're getting some form of help.
Yeah, I think that's so important. Thank you for that, LJ. I know that Nick mentioned the Take on Tinnitus website earlier, but I will link it in the post-event email so everyone has access to that. But I would highly recommend that. And it's a very good, useful tool for those waiting for an ENT appointment, as these are management tools that you can try at home as well. So thank you very much for that. I am conscious of the time. I know I wanted to leave some time just to discuss research with both Kevin and LJ, because I think it's important to discuss it and make sure that people are hearing what's going on and they haven't been forgotten about, because I know that can feel that way. But I would like to just kind of hand over to Kevin and LJ if there's any updates from your end and findings.
Yes, I can give an example of one of the studies that we're just about to embark on. We have been able to secure funding that will allow us to do a comprehensive sort of clinical and diagnostic assessment on, and in this study, it's people who have been hospitalized that we've chosen to go for. And we will compare people who are hospitalized because of the severity of COVID-19 symptoms versus people who are hospitalized for something unrelated to COVID-19, maybe pneumonia, for example. And that means we'll be able to carefully compare the two groups. And the way we're going to do this is we have in Manchester a bespoke hearing research van. We often refer to it as the ladies in the van because it's been 2 ladies that have been driving around in it, a bit like the Alan Bennett story and film and play. So we're going to drive to the homes of individuals who don't have to come to us, which makes our study very accessible to people, particularly if they still don't want to come into hospital or university environments. So we park outside and they'll come down their garden path in their slippers into our research van, which has proper sound treated booth in it that we use for all our research. And we'll do a comprehensive assessment. And we'll compare the people who had COVID with the people who didn't to see, is there something specific about the people that had COVID that means the numbers are higher? And we're hoping that that will give us an idea of the sort of burden or the prevalence of problems. We might be able to identify where in the ear or the auditory system the damage has been done, if we do indeed find some damage. So there's different test procedures we can use that can identify different parts and sort of the pathway between starting at the ear, going all the way up to the brain. And we will also look at biomarkers, things that indicate why someone might get the disease or have a tinnitus more than someone else. So the sort of biomarkers we'll be looking at will be comorbidities, for example. their treatment when they were in hospital, the medications, because we know that most medications can have some sort of side effect. Usually they're rare, that's why we still use them, because on balance they're good. So we're going to look at these as well to try and identify what might have caused the tinnitus. And I noticed in the Q&As, I was just trying to scan them as Eldri was talking. So someone had said, is it possible that it's our immune system that's caused the symptoms? And that's a very interesting question. If we can demonstrate that people do have tinnitus or hearing loss as a result of the virus or the vaccine, let's just take the virus right now, we have to think, what exactly has gone on? Is it that the virus has directly damaged the hearing system itself? And that might be the case. We hear that the way the virus gets into the cells in the body and damages them is it gets in this kind of door into the cells that are called the ACE2 receptors. And there's not a lot of evidence that we have these ACE2 receptors in our ear, but we don't know for sure. But it might be that the way our body tries to fight the virus is what causes the problem, that we have an abnormally strong immune response, the thing that people refer to as a cytokine storm, where our immune response is so strong that it starts to damage our body. That indeed could be one explanation. Or we also hear about people, because of the immune response, have a problem with blood clotting and clots and thrombosis. That could explain it. So there's a whole number of things, and we're hoping to try and tease some of these things apart in this study. We have the money, and I think next week we're going to pilot, just test everything's working. We're going to look for a willing volunteer, and once that happens and we're happy, we'll be on the road in our ladies in the van collecting the data.
That's really interesting. Just a question, because I'm sure, imagine it will come up. Can people get involved in this? Or have the participants already been selected?
No, we because the numbers are so high for this particular study, we don't think we'll have to drive as far around the country. We think there'll be enough people in the northwest and the Manchester area. So our intention is that the healthcare professional who's looked after these individuals will contact them to say there's this study that might interest you. But if there was someone, so for this study, it's people who have been hospitalized we're particularly interested in. If there were individuals within traveling distance with our van in the northwest, then we would be happy to hear from them. I think the easiest way would, if people just probably Google my name, Kevin Munro at Manchester, I think you'll find my contact details and you could get back to me that way.
Thank you so much. That's really interesting. I'm looking forward to hearing the results of that research. I am conscious of the time, and it does bring us to an end. I appreciate there were many questions around the vaccine, but I think the collective response here is there's just not enough evidence yet. But hopefully there will be some carried out in the future, especially once we've got some more accurate information. But that just leaves me to say a massive thank you to our panel. I know that there's been a variety of questions, and I really appreciate your input today. So thank you for everyone for joining us, and you'll receive a copy of this recording shortly after, but that just leaves me to say thank you.